Schema-Focused Therapy, SFT, Overview. Introduction to Schema-Focused Therapy, SFT. Definition and origins. Schema-Focused Therapy, SFT, developed by Dr. Jeffrey Young, integrates elements from cognitive behavioral therapy, attachment theory, and psychodynamic concepts. It is designed to treat chronic psychological disorders by addressing maladaptive schemas formed in childhood and adolescence. Purpose and goals. SFT aims to identify, understand, and change deeply ingrained patterns of thinking, feeling, and behavior, schemas, that contribute to chronic mental health conditions like personality disorders, depression, and anxiety. Historical context. Development of SFT originated in the 1980s as an extension of cognitive behavioral therapy. SFT was created to address the limitations of traditional CBT, particularly in treating personality disorders. Influences, draws from multiple therapeutic models, including attachment theory, Gestalt therapy, and psychoanalysis, to offer a more comprehensive approach to understanding and changing dysfunctional patterns. Theoretical foundations of SFT. Schemas. Early maladaptive schemas are enduring and self-defeating patterns of thinking and behavior. These are developed in childhood and adolescence as a response to unmet emotional needs. Types of schemas. Common schemas include abandonment, mistrust, emotional deprivation, and defectiveness. Formation of schemas. Discuss how these schemas form, often as a result of toxic childhood environments, neglect, or trauma. Modes. Different states or aspects of the self, such as the vulnerable child, angry child, detached protector, and healthy adult. Modes can be adaptive or maladaptive. Coping styles. Maladaptive coping mechanisms that individuals develop to deal with their schemas, including avoidance, surrender, and overcompensation. SFT in practice. Assessment and diagnosis in SFT. Identifying schemas. Techniques like clinical interviews, questionnaires, e.g., Young Schema Questionnaire, and exploration of childhood experiences are used to identify schemas. Understanding modes. Identifying and differentiating between the various modes a patient experiences, often through case conceptualization and therapeutic dialogue. Coping styles. Assessing how patients have historically coped with their schemas and how these coping styles manifest in their current behavior. Therapeutic techniques in SFT. Cognitive strategies. Cognitive restructuring to challenge and change maladaptive beliefs associated with schemas. Experiential techniques. Techniques such as imagery rescripting and chair work to address emotional aspects of schemas and reprocess traumatic memories. Behavioral pattern breaking, encouraging new, healthier behavioral responses to situations that typically activate schemas. Mode work, helping patients shift from maladaptive modes, e.g., vulnerable child, punitive parent, to healthier modes, particularly the healthy adult mode. Case conceptualization in SFT. Creating a case conceptualization, developing a detailed understanding of the patient's schemas, modes, coping styles, and life history. Treatment planning, setting specific, measurable goals for therapy based on the patient's unique schema profile and the desired outcomes of therapy. Applications of SFT. SFT for personality disorders. Borderline personality disorder, BPD. How SFT addresses the core features of BPD, such as emotional instability, fears of abandonment, and self-destructive behaviors. Narcissistic personality disorder, NPD. Understanding and treating the schemas and modes associated with NPD, including grandiosity, entitlement, and vulnerability. Avoidant personality disorder, AVPD. Addressing the core schemas of shame, defectiveness, and social isolation in individuals with AVPD. SFT for mood disorders. Depression. How SFT helps patients recognize and challenge schemas related to worthlessness, hopelessness, and inadequacy. Anxiety disorders. Treating schemas that contribute to chronic anxiety, such as fear of failure, catastrophizing, and perfectionism. SFT for trauma and complex PTSD. Trauma-informed SFT, adapting SFT techniques to address the specific needs of individuals with trauma histories, including complex PTSD. Imagery rescripting for trauma, using experiential techniques to reprocess traumatic memories and alter the emotional response to these memories. SFT in different settings. Individual therapy. Process and techniques. how SFT is structured in one-on-one sessions, including a focus on therapeutic relationship, mode work, and homework assignments. Role of the therapist. The therapist's role as a limited reparenting figure, providing the patient with the nurturing and guidance that were missing in their early life. Group therapy. Group dynamics in SFT. How group therapy can provide a supportive environment for schema work, with a focus on feedback from group members and role-play exercises. Advantages of group SFT. The benefits of sharing experiences, challenges, and successes with others who have similar schema profiles. Couples therapy. SFT in relationships, addressing how schemas and modes affect relationships and contribute to conflict, misunderstanding, and disconnection. Improving communication, techniques for helping couples understand each other's schemas and modes, leading to more empathy and effective communication. Challenges and criticisms of SFT. Common challenges in SFT. Resistance to change, how deeply ingrained schemas and coping mechanisms can make change difficult, and strategies for overcoming resistance. Complex cases, managing cases with multiple, overlapping schemas and modes, particularly in individuals with comorbid conditions. Criticisms of SFT. Effectiveness, discussing the evidence base for SFT in areas where more research is needed. Limitations, addressing the potential limitations of SFT, such as the time-intensive nature of the therapy and the need for highly skilled therapists. Research and evidence base. Efficacy of SFT. Clinical trials and studies, a review of key studies that have tested the efficacy of SFT in treating various disorders, including personality disorders, depression, and anxiety. Comparative effectiveness, how SFT compares to other therapeutic modalities, such as traditional CBT, DBT, and psychodynamic therapy. Advancements in SFT research. New developments, emerging research on SFT, including adaptations for specific populations, e.g., adolescents, culturally diverse groups, and integration with other therapeutic approaches. Future directions, potential future research areas, including the use of technology in SFT, such as online therapy platforms and virtual reality for experiential work. SFT and cultural considerations. Cultural adaptations of SFT. Adapting SFT to different cultures, how to tailor SFT to be culturally sensitive, addressing the unique schema profiles and modes that may arise in different cultural contexts. Challenges of cultural adaptation, discussing the challenges and strategies for therapists working with clients from diverse backgrounds. Conclusion. Summary of key points, recap of the main aspects of SFT, including its theoretical foundations, techniques, applications, and challenges. The future of SFT, a look forward at the potential for SFT to evolve and continue to provide effective treatment for complex psychological issues. If you enjoyed this video, don't forget to hit that subscribe button and join the NI 655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.